There are several big medical stories we're following today.
Buffalo Bills defensive player Damar Hamlin, of course, remains in critical condition after collapsing on the field during last night's game against the Bengals.
And as COVID cases continue to rise, the U.S. will require all travelers from China to show a negative COVID test. Dr. Jeff Pothof is here with this weekly visit. Good to see you again.
Hi, Dr. Pothof.
Good to see you guys.
Let's talk first about the football player, not specifically his case because we don't know his history, but a cardiac arrest is different than a heart attack.
Yeah, so most cardiac arrests are caused from a heart attack where you get a plugged vessel in your heart. Eventually that causes an arrhythmia, you go into cardiac arrest. But there's other things that can cause cardiac arrest too. Some people have underlying heart arrhythmias that can stop your heart. Some people have an enlarged heart, and with exercise that can sometimes start your heart. Some people can have a big blood clot in their lungs and that can start your heart. So a lot of things can cause cardiac arrest in addition to heart attacks.
And how vital is time when something like that happens?
It's pretty much the most vital thing, because cardiac arrest means your heart's not pumping blood, and if your heart's not pumping blood, you're not getting oxygen to your brain, and brain cells start to die. So it's really seconds to minutes that you have to reverse that before someone either will pass away, or if you do get them back, has irreversible brain damage.
And we don't know what his condition is going to be, but they had his heart going pretty quickly.
Yeah, I mean, if there's any silver lining, he was in an environment where there were first responders immediately available, trained, they knew what to do, they had all the right equipment there, so you really couldn't have a better opportunity to do well in that kind of situation. A lot of people aren't so fortunate where this maybe happens at home or a workplace, and there isn't someone who knows CPR, or there isn't a defibrillator, and those folks don't do as well.
But this was very rare, like 10 to 20 cases a year.
Yeah, it's very uncommon to see this happen in young individuals, and like I said, we don't know risk factors or things like that, but in otherwise healthy individuals to have this happen, certainly not common.
Yeah, very tragic, and we'll continue to watch it, and hopefully everything will be okay. Let's switch gears a little bit and talk about COVID. COVID cases are rising. A new subvariant is emerging. Just anecdotally, I'm hearing from a lot of people who are suddenly testing positive again. It feels a little bit like, here we go again. What level of protection do we have against any new variants that are emerging?
Yeah, I mean, it's tricky right now. So this new variant, XBB 1.5, is an Omicron subvariant, but we know that it's a bit more slippery, and by that we mean it does a better job of evading our antibodies or our immune systems, which means that more people will likely come down with symptoms when exposed to this variant than, say, BA4, BA5, especially if they had that bivalent booster. It still looks as if we get pretty good protection from vaccination, maybe even previous infections, so we may not see a significant spike in, say, hospitalizations or deaths, but I wouldn't be surprised when you put together this new variant that's pretty transmissible, better at causing symptoms with all these holiday gatherings, that we will see a bit of an increase in COVID cases over the next several weeks.
How is the flu situation?
So flu is still at a high level, but if there's good news, it's the last 2 weeks we've seen it come down a little bit. So it's still way too high, higher than we typically would see, but instead of continuing that skyward trajectory, it's come down just a bit. So let's hope that that trend continues.
We've talked that the flu vaccine is a good match to the current strain. Then why are so many people getting the flu?
Yeah, it's kind of like what we learned with COVID. So it's not that the vaccine completely protects you against getting flu at all, but it significantly reduces the severity of your symptoms. So a lot of people can still get flu even if the vaccine's a good match. But what that does mean is that people who are getting flu, I think the numbers are about 50% of them are very mild. The other almost 50% moderate, and only a couple percent being severe. And that's more of a testament to the vaccine matching than people getting or not getting flu.
All right, lots going on.
Busy.
We'll see you again next week.
You bet.